In 2006, primary healthcare delivery system in Bauchi State almost collapsed. It was characterized by dilapidated infrastructures, lack of skilled personnel, inadequate basic equipment, drugs, water supply, and electricity. The facilities were mostly deserted by the public, and the few skilled personnel had lost interest and morale in the services. In 2006, Bauchi State had 1,100 primary health care facilities with 875 functional. 40% of the facilities were dispensaries, 19% maternities, and 13% were primary health centers. They were mainly providing consultative services, as the patients were sent out to buy drugs and consumables. In 2007, dawn of a new era for Bauchi State primary healthcare delivery system began upon assumption to office of Malam Isa Yuguda Matawallan Bauchi as the newly democratically elected governor of the state.
We inherited a comatose health sector and several other sectors, including, of course, education and so on and so forth. But the health sector, immediately on coming into office, I invited a team of consultants to go around all the hospitals and give us a very comprehensive report. And the report they presented to us was very scary. In fact, in the report, they did advise that we should close 3 hospitals, that of Tafawa Balewa, that of Kafin Madaki, and also that of Zaki. And they also gave us the state of conditions of the other hospitals, which were very deplorable. In fact, they did mention categorically in that in those hospitals they recommended we should close. If we don't close them, 95% of the patients will die, either as a result of the ailments that brought them, or because of the very filthy environment, they are likely going to infect another disease that will kill them. So we just had to close the hospitals and start reconstructing new ones. And we also had to address the problem of equipment. We had to bring in so many equipments because completely there were no equipments in the hospital, from theaters, laboratories. In fact, in all the hospitals there was no water, including, of course, the specialist hospital here in Bauchi. We have to, I believe you have seen the borehole we constructed. We had to break, the tarred roads to locate where the control of the water pipe that comes from Gubi, so as to make it possible in the event that the pump water from Gubi comes into the hospital. We did not only do that, but we also went to the extent of providing 24 hours electricity supply to the hospitals. So all the hospitals are equipped with generating sets, and we make sure that we have provided in our mandatories the fueling of the generating sets, so that at least whenever NEPA is off, we have at least light in the hospital. In the event that they are performing some operation, at least there will be lights so that the patients will not die. And at the same time, there are certain equipment that we brought in that cannot afford not to have constant light power supply. So we also drilled boreholes in all the hospitals and made sure that there was sufficient water, because the water itself is medicine. And not only that, we entered into public-private partnership with a pharmaceutical company, Niemann, to supply us drugs. So all our hospitals are stocked with drugs, not expired drugs, all drugs for all ailments. We made sure that we provided that one. And we also got the National Insurance, Health Insurance Agency of the federal government to come and provide the service to our civil servants. So they pay only 1/4 of what they ordinarily would have paid for their family, so as to alleviate the sufferings of the civil servants.
In the course of this program, we have gone round Bauchi State in order to capture the transformation, or revolution if you like, going on in the primary healthcare system in the state.
Ciwon cikin ya daina? Amai fa? Dikin daina? Ba zazzabin ma?
The new General Hospital in Azare is a good starting point. It was commissioned in 2008. The structure is world-class and equipped with facilities in similar manner. The General Hospital in Azare is comprehensively equipped and staffed. The accident and emergency ward is attending to patients. Provisions are also made for inpatient admissions. There are male and female wards. The pediatric ward is also catering for children, while the maternity ward attends to expectant mothers. In order to ensure regular water supply, a giant tank is made available. Due to the crucial nature of electricity to hospital services, generator and regular diesel is supplied to sustain power supply. Jama'are General Hospital was equally built by Uganda administration and having 120 bed capacity.
This is the main operating theatre of the General Hospital Jama'are, and it's a setup of a modern theatre. We have most of the facilities and equipment available. For example, this is a modern theatre bed which is functioning and is in use. Our major operation days are Tuesdays and Thursdays, and we used to have at least from 7 to 9 patients per week for the surgery days. This is our ultra-modern anesthetic machine, which is electronic, and it has to be working with oxygen. This is the sterilizer we are using. Its function is for the sterilization of the equipments we use on surgery. The equipments are used to be put inside, then connect with light and make it sterile.
Since commissioned, the hospital has witnessed an upsurge of patients' attendance. They enjoy the services of a dental clinic, X-ray facilities, prenatal and postnatal, ultrasound plus constant water and power supplies. Dr. Obina Eze, Chief Medical Officer of the hospital, says this about Governor Isa Yuguda's revolution.
He has made the environment a bit conducive for us to work. Secondly, the issue of accommodation, which has been a threat to so many workers, especially in the rural area, has also been tackled. Like here, I think about 4 houses has been renovated, and we are sure that the renovation is ongoing. Basically, the healthcare system has actually improved.
The Ningi General Hospital is another evidence of the focus of the Uganda administration on the health sector. The hospital has 100 bed capacity and can handle outpatient demands of 150 per day. According to the acting chief medical officer of the hospital, their laboratory is unique and a source of pride to them.
Here we have, as you can see, we even have our system where we can keep some records. We also have UPS. The reason why we have this plan, though it is supported by some of the organization with the help of the state government and other agencies, so we have our power supply and the UPS. So this UPS will maintain power for 24 hours. And the beauty of this UPS, whenever there is light, it will automatically stop and it will continue storing the light for further use. Then it will automatically start using NEPA. We also have here, as I say, our lab is unique. We have the CD4 machine. So the CD4 machine, as you can see it here, it is specifically, as I say, for the those that are HIV infected. So whenever we keep them, before we commence them on medication, we have to come and know the level of their CD4 count. So this is the machine. That is the CD4 machine for those that are HIV positive. We also have machine for the chemistry. before, you know, as you know that most of their medication, they are strong medication, so you need to know all the label of their system. System is intact. So this is for the chemistry here, and we also have hematology machine. So this is the hematology machine. The hematology machine, as you can see it here, this one is for the full blood count and differentials, PCB, and also other related hematological investigation. While this one we will do renal function test, electrolyte, urea, and creatinine. So we also have our refrigerator. This one to maintain the cool chain. This one is a modern type, and this one is to maintain the cool chain. So this one is automatically attached to the UPS, the power supply. So this one is receiving power for throughout 24 hours, so without any problems. So we also have our desk for our lab technicians. We also have the other consumable, as you can see. So that's why we say our laboratory is intact, because most of the investigation we need for almost all our patients, they are always available, more especially those that have retroviral disease, because they are the ones that need to be fully investigated before we can commence them on medication.
It is apparent that the old hospitals in Jama'are and Bauchi were left and completely new structures were built. The Honorable Commissioner for Health in Bauchi State explains.
The rationale behind that is, we are always developing. All our areas are always developing. So we now started thinking that, okay, maybe one day we may need to expand all these facilities on the ground. So we say, okay, let us, and the fact that they are highly deteriorated, so we say, okay, as a matter of urgency, let us build up new ones. Then in due course, we will now concentrate on renovating the existing facilities, so that it will accommodate all the expansion that will be needed.
The brand new General Hospital at Tafawa Balewa is indeed a source of joy for the Chief Medical Officer and all his staff.
Everybody is very happy, because if you are working in an environment where there are instruments on the ground, you love it, because that is what is called job satisfaction.
In fact, we are finding it very impressive now that we are in a good condition. We are living in a good condition, and the work we are doing here, we are finding it very nice, unlike before.
The hospital is equally equipped with state-of-art facilities, which attract outpatients of between 70 to 100 daily. Thursday, being the market day, records the highest inflow of patients to the hospital. The chief matron of the hospital is forwarding special requests to further strengthen their service delivery.
Actually, the complaint that we have in this particular ward, that is the maternity ward, we don't have antenatal site for our pregnant mothers. It is the other side of the ward that we have converted it to attend to our clients during clinic. And we don't also have site ward.
Furthermore, an admitted patient, Yawana Luka, wishes to express her gratitude to the government, as well as call upon it to...
I request to the government is that they should try and look into the problem of this area, because the condition here, we have too much mosquito, and the patient, some of them, they may go back with malaria. Well, it's not our wish, so they should look onto it.
At the Bauchi General Hospital, we were amazed at the level of infrastructural developments and the visionary policies put on course.